Good afternoon, everyone, and welcome to the Corporation to Develop Communities podcast, the CDC Experience. I am Sartora Schumann Smith, Program Manager here at the CDC, and today we're going to be speaking to two amazing women. Barbara Arocha Diaz is here with me now, and she is the Community Patient Navigator at Moffitt Cancer Center. And later we will have Kanisha Avery, who is also a manager at Moffitt Cancer Center. But we're here today, and I am in my pink because we are recognizing Breast Cancer Awareness Month. And everyone knows that October is Breast Cancer Awareness Month. So what better people to have here with me today is the folks from Moffitt Cancer Center. Welcome, Barbara.
Thank you so much, Sator. I'm pleased to be here and to share this opportunity with you.
Thank you so much, Barbara. I have to tell everybody in the audience, and if you're watching, or if you're not watching, or you need to watch, you can always find us on Facebook, Instagram, Spotify, and you can also find us on our website at www.cdc of Tampa. So make sure you tune in. I have to let everybody know, Barbara, that we've been friends since how long?
Since junior high school.
Since junior high school. You know that's a long time, folks, because they don't even have junior high schools anymore. So that's a long time. But Barbara has been around in my life for a very long time, and it's so awesome when people can come back full circle.
Yes.
And so, Barbara, we're going to talk about what you do at Moffitt Cancer Center. I know it says Community Engagement Navigator, but exactly what do you do?
What I do at Moffitt is I am a community patient navigator, and I work with underserved and uninsured women in our communities and giving them access and removing barriers to health care and giving them access to free, no-cost mammograms.
And I think that's awesome. And you said something very key in free.
Yes.
You did say free.
Yes.
And you said in underserved communities. And I just know from experience, from personal experience and from professional experience, so many communities are still not being reached when it comes to being educated about breast cancer. And I know later we're going to talk to Kanisha a little bit more about that. But I want to talk about our partnership. I am just excited that we are partnering with Moffitt, because when you hear Moffitt, people hear Cancer Center.
Yes.
But you all do so many amazing things in the community with the families, with the patients. And we just did something really, really cool with Moffitt. We did a ladies' night. So tell everybody what the ladies' night event was all about.
Oh, it was a lot of fun. It was bringing awareness and information and education on breast cancer and how prevention is key to preventing getting an advanced stage of breast cancer. And so prevention is key, and the way you do that is by getting your mammograms regularly on an annual basis.
And I like the fact that the event was called Ladies Night, well, because we partner with our We Mean Business group from Tuesdays. But I think a lot of times when you have events like that, or when you're going through something like breast cancer, or just even afraid to maybe go get that mammogram, I think having that support around you is so important, because a lot of people don't have that. And just to see all of the ladies in the room just sharing their stories and the excitement about it, it really made a difference. And I am, again, so pleased that we are partnering with Moffitt. We partner with Moffitt for human resources, for our workforce. But on this level, it makes it a lot more exciting and engaging for everybody. So if you have not had a mammogram, if you're still contemplating having a mammogram, there are so many resources out there. Somebody can just go to Moffitt Center's website to find out more information, or they can reach out directly to go on our website and find out more information about Moffitt. So you can go to our website at www.cdc of Tampa, where you'll find this podcast. You'll also find this podcast on Facebook, Instagram, LinkedIn, all social media, Spotify. So people definitely don't want to miss finding out more about breast cancer and breast cancer early detection and breast cancer awareness. So Barbara, I have one more question for you.
Yes.
And I did get permission first from Barbara to ask this. So working at Moffitt is just not a job.
No, it is
It's
not.
not just a job for you. You came to Moffitt with personal experience about
Yes.
breast cancer. And I'm not going to steal your thunder. And I think this episode of our podcast means a lot to me, because I too am a survivor. So I want you to tell everybody your experience and how the work that you do ties into your personal life.
As a 17-year breast cancer survivor myself, I threw myself into as much information that I could learn about breast cancer during my treatment. And I went as far as to do a lot of advocacy volunteer work. And while doing that, I also volunteered for several national organizations around the country. And my theme, my focus was on getting ladies early detection and early prevention to avoid having to get a high stage cancer, and not catching it early on where you can be treated and not lose your life, because it is very important.
So how did you get through your and I don't like the word battle because you are an overcomer. You won the fight. So how did you get through the diagnosis and the treatments and the recovery?
Like I said, by learning as much as I could about breast cancer and throwing myself into advocacy work, that was very important to me. And as a result of that, I was able to apply for a position at Moffitt that was for the patient navigator in the community. And I am just so excited about what I do. I love helping ladies. I love removing the barriers to health care. I love informing them and educating them on what breast cancer is and how to prevent it and how to be a survivor and thrive.
And so there is a way to survive.
Yes, there
And
is.
and I don't think there's a toolkit or a rule book, but I think it's that support, once again, that support from hospitals like Moffitt Cancer Center, or for organizations that are out there serving people with breast cancer. And women aren't the only ones that can get breast cancer. We have to make that very clear. Men can also get breast cancer, so they have to be aware as well. But just forming that support system that you all bring to the table and getting your circle of friends surrounding you, to help you become a survivor. So anything else you'd like to say, Barbara?
I would like to say that if you need to be screened, or you please get your referral from your physician and have them send it to the Moffitt Cancer Center. And we will contact you and ask you some questions, screen you to see if you qualify for our Screening Access Program, which is the program for a no-cost mammogram.
Thank you, Barbara. And before we end, I just want to say to our audience, you have people here like Moffitt Cancer Center who really, really care. And I know this from personal experience. So again, just make sure that you have people around you rallying in your corner, fighting for you. And I love the fact that you were able, Barbara, to open up personally and share your story, because a lot of people never know what somebody is going through or has gone through until you share. So your story may have saved one life or may save many. So we appreciate having you here, Barbara, from Moffitt Cancer Center.
Absolutely. Thank you so much for having me, Satora.
Thank you. Good afternoon, everybody, and welcome back to the second half of the CDC Experience, the Corporation to Develop Communities' very own podcast. And again, I am Satora Schumann-Smith, Program Manager here at the CDC. And I have another very special guest here with me. I met this lady a few months ago, and she's just amazing. And I'm so blessed to have amazing people just come into my life for whatever reason. And right now we have Miss Kenesha Avery from Moffitt Cancer Center. And I'm going to, before I ask you what do you do at Moffitt and your title, yes, we're recognizing Breast Cancer Awareness Month here, not just here at the CDC, but all across the world, all over the globe. October is the month that we recognize breast cancer awareness and early detection and survivorship. So right now, you were at Moffitt, and I think you said you've been there for 4 years.
Yes, that's correct.
But I know you have a personal connection to Moffitt or to the community and the patients that you serve. So if you don't mind, can you please share your personal experience and why October and every month is meaningful to you?
I don't mind sharing at all. I turned 40 September of 2016, and I went to the doctor for my annual physical, and she said, oh, well, you turned 40 this year, so why don't we go ahead and get your mammogram? And they had the mammography machines in the office. And I went ahead, got my mammogram, and then she called me back. She said, oh, something doesn't look quite right, so I'm going to send you for an MRI, further testing. So growing up, I always had fibrocystic breast. So I was like, oh, it's just another fibroid. It'll be fine. And so lo and behold, come through all the testing, they called me back in, and they said, you do have breast cancer. And so that was December 2016, and then I had a bilateral mastectomy of March of 2017.
So tell me again, if it's okay to ask this question, what went through your head when you first heard that you have cancer?
Um, I was shocked because other than my mom's sister, who at the age of 65 had breast cancer, no one else on either side of the family had breast cancer. And so I was shocked, but then my personality is I have to do what I have to do to get healthy or return back. So the first thing I said was, what do I need to do? And so I'm a person of faith. And so I immediately, prayed to God, and it was surprised. I guess I wouldn't say I was surprised, but there was a sense of calm and like, you're going to be okay. And so from that moment forward, it was, okay, I need to get my bilateral mastectomy. Okay, let's do it. And so my doctor ended up calling me, and he was like, I just had to check on you because, most people are crying or, they're hysterical, but you were just so calm. And I just told him, I was like, God, but God. And so it was, it was nothing but God. I have a very good support system in my family and my husband. And so they were with me every step of the way. And so I can honestly say, after the initial shock of hearing the words, it was this overwhelming sense of peace because of my relationship with God.
And I love hearing that. And so you've now been a survivor for how long?
Well, technically 2017 when I had my mastectomy, so 6 years.
Okay, well, congratulations.
Thank you, and same
6
to you.
years. Thank you. Thank
Yes.
you. 6 years of still being here. And
Yes.
just how ironic is that you experienced breast cancer
Yes.
and now you work at Moffitt Cancer Center.
And that was my driving force. So again, God leads you down paths that you would never think you would go on. And so after I went through my experience, I began to question, like, well, why did I go through this? And there was a reason why I went through this. And so from that moment forward, I was always in the healthcare field, public health and physical therapist. So I was always in health, but not cancer health. And so because of my experience, I was like, I'm going to work at Moffitt Cancer Center. And lo and behold, the position that I'm in now was available, and I read it, and I was like, man, all of my experiences through my 20 plus years of being in healthcare, it was a cultivation of everything that I had done over the years. I was always in health promotion, health education, and it was in health, population health management. And so all of these things that I have experienced and worked in over the years, it just led me to this position. And so when I read the job description, I was like, well, I guess this is where I'm supposed to be. And so applied, interviewed, and here I am 4 years later.
And it's so amazing to me when you hear people talk about God and their faith, and we don't have a problem talking about that here at the CDC. So I welcome that.
Thank you.
That, you hear people always say that God works in mysterious ways, and now how mysterious is that?
Yes.
How any more mysterious can that be, that you had to go through it, and in order to feel that now you're more qualified and you're able to share your experiences, and those experiences I know help other people out. So one of the things, and mammograms for me are my birthday every year, September.
Yes.
So we share the same birthday month, but every September it's a mammogram for me. So tell the audience, Kenesha, that may not know or may not be listening as carefully as they should, why is early detection so important?
The earlier you can detect it, the earlier and the better your outcomes. We know for some people, hereditary or it's genetics. And so eventually, most of the time, in some cases, when it's genetics involved, you may get breast cancer. But going in early and knowing early, there are treatments and you have a better outcome of surviving or treating the breast cancer and have better outcomes.
Thank you. And like I said, I do it every birthday, so it's just become routine for me. But I know a lot of people have fear. about not even finding out if they have cancer, but fear of having a mammogram. I hear
Yes.
people say it's going to hurt, it's uncomfortable. You know, what is all this equipment around me? If you can, I'm trying to visualize it myself. So if you can, walk somebody through a mammogram.
So I'm going to put the disclaimer, I'm not a physician.
Okay.
So I don't want anyone, but it's really an image. So, you know, you put your breast on the plate, and then they take an image of the breast with radiation going down to actually see in the breast to detect. And now they're more advanced because they have these fast MRIs that really can detect like the smallest of cancer in your body. So, and my perspective is, it may be uncomfortable, yes, because you know we've all women starting at age 40, we go through it. But think about that one time of being uncomfortable versus finding when you're stage 3, stage 4, and then the pain that you're going to go through, the surgeries, the radiation, the chemotherapy. So doing it early, and you may have that minor or small moment of being uncomfortable, and you're able to detect it, hopefully not. If so, think about that versus having to go through chemotherapy, radiation for 6 weeks every 15 minutes. So think about what it would be like had you not done it earlier and been detected earlier.
Absolutely, absolutely. And it's not, so bad. I can't speak for
Right.
people's feelings, but it's not so bad. It is more uncomfortable. And I think maybe
Yes.
just, we being modest women, sometimes that may be the discomfort that is there. But let me ask you, how often should you be screened for breast cancer?
So guidelines are starting at age 40, and then you get them annually. For some who it may be running your family and it's genetics or hereditary, you can start as early as 30 or 35.
Wow, I didn't know that.
Yes.
Okay, so ladies, you hear that out there? 30 or 35.
Yeah.
40 is the average, but annually, find a date on your calendar and you can say, every year it's this
Yes.
date I am going to do this. At Thanksgiving, for gratitude, for holidays to celebrate, for your birthdays to commemorate. So find a time and have those mammograms done. And I'm going to ask a question. How can you get screened if you have little or no insurance?
So I believe Barbara mentioned it also. It's our screening access program. So it's based on financial guidelines or financial eligibility. But even with that, Moffitt does not turn anyone away. So we make sure that if you're not able to get the screening with us, we do partner with the health department. And so if you're 50 or older, you can get a no-cost mammogram through the health department, but we do not turn anybody away. So,
And that's so good to
program.
hear. And I had to share a story of mine now,
Yes.
of my Team Moffitt story. For about 2 years, I was out of work due to a major illness. But I was so adamant that I had to have that mammogram done because of, what I had gone through. So it was like, what am I going to do? I can't afford to go get a mammogram. And a friend of mine, and I'm going to give her a shout out because she was my hero, and she is a hero. Her name is Tiffany Lott, and she went through Moffitt Cancer Center. And she said, call Moffitt and ask for a certain department. Tell them you're not working. Tell them you don't have insurance, because I'd lost my insurance and everything. So I called and I got an appointment, and they said it was no cost. And when I got there, the lady was just the way Moffitt is all the time. They were just so comforting and so reassuring. And she said to me, in the event, preferably not, something we see after this, then you're fine. You'll be fine from this point on. We will take care of you, and you won't incur a financial responsibility. And that for me was just like, it's making my heart feel special right now, because so many people don't get the health care that they need and that they deserve because we don't know.
right.
And we don't know what's available. So it's just been a pleasure talking to you and talking to Barbara earlier about what Moffitt is doing and how they're out there to help the people. So again, repeat what can somebody do if they don't have health care insurance?
So they can call Moffitt at 1-888-MOFFIT, and then they could be connected to our office, Community Outreach Engagement and Equity, and then we will take it from there. So all you have to do is say, hey, I don't have any insurance, but I do need to get a mammogram, and then they will know to transfer to us. And we will, you can also call our 1-813-745-COEE, and that's our direct line. And then there's a menu of options, and you can ask to speak to our resource specialist or a navigator, which is Barbara, and they will be connected directly to our office.
Okay, so you all heard that. So I hope you've been listening on YouTube, on Spotify, on Instagram, on Facebook, or you can go to our website at www.cdcoftampa.org. And I just want to say thank you to you and Barbara again, Kanisha. And I just want to say to everybody who missed the Ladies' Night event, we will be partnering more with Moffitt for other events. And I just, again, ladies, men, please, early detection is important, and you've got to save your life. You got to wear that pink ribbon. You got to show your support for others. And we just thank Moffitt Cancer Center for the work that you're doing in the community.
Thank you, and thank you for having us.
Absolutely.